today's headlines. Come on, let's check them out. Alright, starting off today's headlines, we're headed over to sfgate.com, home of the San Francisco Chronicle. They're reporting that seniors are being urged to get whooping cough shots. In what could be the worst year for whooping cough in more than 5 decades, state public health officials brought in recommendations Monday for those who should be immunized against the disease to include seniors and women in their childbearing years. As of Friday, there were 1,496 confirmed cases in California of whooping cough, a 5-fold increase over last year. The childhood whooping cough vaccination does not provide lifelong immunity, and health officials said that the disease is cyclical, with an increase in cases every 5 years. The last significant outbreak was in 2005, the same year a booster shot for the disease became available to offer added immunity for about 7 years. Alright, headed over to Examiner.com. They're reporting that United Health Group is forecast to make $93 million in revenue. It's reporting health insurer United Health Group announced that its second quarter profit rose 31%. The company, which is based in Minnetonka, Minnesota, United Health earned $1.12 billion in the 3 months that ended June 30th. That equates to 99 cents per share, up from 73 cents per share during the same period last year. The company raised its profit forecast for the year. United Health Group is now expected to earn $3.40 to $3.60 per share, up from $3.15 to $3.35 per share, on $93 billion in revenue. United Health is the largest publicly traded health insurer based on total revenue, and the second largest based on enrollment. Alright, headed over to WebMD.com. They're reporting that scrubbing the toilet just got a little more unpleasant, something we hadn't thought possible. According to new research published in the journal Environmental Health, women who use household cleaning products regularly may run a higher risk of developing breast cancer compared to women who use such products sparingly, and those reporting the highest usage may face double the risk. More than 1,500 women were involved in the study, 787 of whom have breast cancer and 721 of whom do not. Participants provided information about their lifestyles, from pesticide consumption, which appeared to have little impact, to product use, and established a suspected risk factors for breast cancer. It is noted that since this study is the first of its kind, that some bias is possible, and to not live in a fear of a clean home. Alright, and heading over to fiercehealthcare.com, they're reporting on the pros and cons of sharing doctor's notes with patients. Allowing patients to read their doctor's notes after their appointments could open a Pandora's box, some doctors believe. Patients might take offense at some of what turns up in the records. For example, they may not know SOB refers to shortness of breath. Those were among a plethora of concerns researchers heard during the planning stages of the Open Notes project, which will explore what happens when patients have access to their doctor's notes. In the demonstration project, more than 100 primary care physicians and about 25,000 patients from several hospitals will be able to access visit notes online through secure web portals. The physicians will invite patients by email to see their doctor-signed notes after each visit and again before the next visit. Physicians had plenty of worries coming into the project. Their biggest worry was of patient calls, letters, and emails that might be a drain on their time. Others said they felt they would have to censor themselves, omitting important diagnostic and therapeutic comments so that speculations about cancer don't trigger panic. Still, others worried that their patients would feel scared, mad, depressed, confused, or hopeless after reading the notes. But there is an upside to the program. It can improve patient understanding of their health, help them digest recommendations, and get them to follow their treatment regimens more closely. It might even get doctor and patient on the same page and help patient caregivers. Alright, now I'll leave you with an interesting story on the next frontier of the health reform. The Associated Press is reporting via Google, while states across the nation grapple with national healthcare reform, a new population of patients is garnering attention in California. Fido and Fluffy. Many feline and canine companions face healthcare challenges similar to those that confront humans. Veterinary care costs are skyrocketing as pet owners are offered a sophisticated menu of potentially life-saving services, including kidney dialysis, sonograms, and chemotherapy. U.S. consumers spent more than $12 billion on veterinary care in 2009, according to the American Society of Prevention of Cruelty to Animals. Yet only about 1% of pet owners have health insurance for their animals. Those who do often don't understand what the policy covers and what it excludes in an industry that has faced little regulation or even attention, at least until now. Democratic State Assemblyman Dave Jones, who is running for state insurance commissioner in the November election in the state of California, says some of the same practices being corrected by the recently enacted federal health care overhaul are used by pet insurance companies, including denying coverage based on pre-existing conditions. Jones's bill, he says, will help transparency in the pet health insurance industry. Alright, and that'll do it for the headlines today. Make sure you check back tomorrow for a new bunch of articles. And as always, check in www.mditv.com/blog. This has been Drew, and you can also find me on Twitter at MDITV.